Dr. Ashok Seth is the chairman of Fortis Escort Heart Institute. So I'll start with you, Dr. Seth, because we're seeing both in Mumbai and in Delhi the numbers peak. The question is this happening because of these new mutant variants? Today the centre said, at least in Maharashtra, there seems to be reasonable evidence. About a fifth of the cases seems to be because of double mutation. What is it, and should we be worried about it?
Yes, we have to be worried about it. It's very clear that we're actually having a second wave, but it's not just the second wave. It's a second wave with complete, look at the numbers rising. It's nearly 1.5 times, from 3,500 to more than 5,000 in a single day. And this has to be multifactorial. And while we can say that it's lack of COVID appropriate behavior, which is correct, there's complete lack of fear which used to happen earlier. We know that there's complacency set in. It's complete disregard for COVID appropriate behavior. But as I'm sure virology experts are fearing that this could be partly due to these mutant strains. Now we've just heard the fact that there's a double mutation on, and while we don't know the implication of double mutation, but the fear, and certainly amongst experts the fear is that 2 mutations on a spike protein can actually maybe make the virus more infective, perhaps less responsive to the immune system, perhaps not even responsive to the vaccines and the immune systems that we create out of vaccines. I believe that it just cannot alone be just the inappropriate COVID inappropriate behavior.
Okay, Dr.
And I would also say that in a sense, everybody above the age of 18, and more so the younger generation who could be super spreaders, the ones who are working, should be vaccinated as soon as possible. I agree that there was a prioritization needed initially to get the vaccination off the ground and actually look at who can get it fastest and who are the ones more prone to have serious side effects or serious consequences of the COVID disease itself. But after having done that, I think it should be more widespread and also targeted at those very areas where we actually see those clusters happening. I really want to emphasize on one important point, and that's the cause for concern now as opposed to earlier, and I say this by experience, and I'm sitting in the OPD now. 6 months ago, there was a greater realization and a greater fear of COVID, and therefore COVID appropriate behavior was common.
Yeah.
Now that we actually sit in the OPDs, people come with their mask down, and for every patient and his relative, we're actually having to remind them to get their mask up on the nose. So it's not just, you talk about covering the face, we actually see it every day. It's 1/10 of the people who are actually putting the mask on they're putting the mask on properly. So it's all improper masking, and this is complacency, carelessness, but it's a lack of fear in a situation where there is no lockdown.